I have paper towel with me. To place my supplies. For my supplies, I have my medication vial, practice pad, gloves. I'll refer to these as alcohol swabs, gauze pad, and a 22 gauge, 1-inch needle, 3 ml syringe. I'll begin by verifying the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. I'll verify the medication orders in the MAR. The order reads, give morphine 6 milligrams times 1 dose. The medication available on hand is morphine sulfate, 4 mg per ml per dose. To calculate the medication that I will administer, I have written the equation on my whiteboard. Nothing on the back. So I will calculate 1 ml over 4 mg multiplied by 6 mg over 1 equaling 1.5 ml. So for the order of 6 mg, I will administer 1.5 ml for 1 dose of morphine sulfate. I'll gather my supplies and head to the patient's room. Upon entering the room, I'll close the door to ensure patient privacy, place my supplies on a clean, dry, flat surface, and introduce myself to the patient. Hello, Mr. Smith. My name is Bessie. I'll be your nurse. May I see your wristband? Can you please tell me your first and last name and your date of birth? Thank you. Mr. Smith, do you have any known allergies such as certain foods, medications, seasonal, anything like that? No? Okay. Well, Mr. Smith, the provider has ordered you 1 dose of morphine. I'll administer 1.5 ml intramuscularly. I'll review its action, use, common side effects, and adverse effects. Now, adverse effects require immediate attention, so if you experience any of these symptoms, please report them immediately, okay? Morphine sulfate is an opioid analgesic. It acts on receptors in the central nervous system that alters pain perception and adjusts the body's reaction to painful stimuli. It's used to reduce acute to chronic, moderate to severe pain or conditions. Sorry. Common side effects are nausea, vomiting, constipation, urinary retention, and dizziness or dizziness. If you experience any of those symptoms continually or they progress, please also report them immediately. Adverse effects could be decreased breathing, hypotension, syncope, or even bradycardia. And just so you're aware, you might feel a slight burning or stinging sensation when I administer the medication. Do you have any questions? Okay, I'll perform hand hygiene and apply clean gloves. I have a 22 gauge 1-inch needle, 3 ml syringe. I'll clean the top of the vial with an alcohol swab. Dispose of this. With my needle, with the syringe pointing up and the cap still on, I'll draw 1.5 ml of air. Sorry, hair. I'll remove the cap. Inject the air into the vial. Invert the vial and withdraw 1.5 ml of medication. With the needle still in the vial, if I notice any air bubbles, I'll tap the syringe to move them to the top and gently push the plunger to remove the air bubbles. I'm going to reattempt that. The tapping did not work. Pull 1.5 ml of air. Inject the air into the vial. Invert the vial. And withdraw 1.5 ml of medication. Again, with the needle still in the vial, if I notice any air bubbles, I would tap them to move them up and push the plunger forward to remove the air bubbles. Now, because I will, for the purpose of this video, because I'll be placing the syringe down, I'm going to recap the needle using the one-handed scoop method. The dosage calculation equaled 1.5 ml. I have 1.5 ml in the syringe. If you can see that. Now, for the injection site, I'll inject the medication to the ventrogluteal site. I'll assess the skin for any bruising, inflammation, edema, or signs of infection. I'll also palpate for any masses or tenderness. If any of those were noted, I would select a different site. I would also rotate sites if the patient received frequent injections. There are no signs of contraindication. The site is appropriate. I'll relocate the site using anatomical landmarkers by placing the heel of my hand on the patient's greater trochanter, pointing my thumb towards the groin, pointing my index finger toward the anterior superior iliac spine, and extending my middle finger along back the iliac crest towards the buttocks, creating a V-shaped triangle. At the center of that triangle is the injection site. Once I've located the injection site, I'll clean the site with an alcohol swab by applying the alcohol swab directly above the site and rotating outward in a circular direction for about 2 inches. I'll allow that to dry completely on its own. I will not blow on it or wave my hand to dry it. Once it's cleaned, I will not touch the site. With my dominant hand, I'll take the syringe, hold it with my thumb and forefinger like a dart, remove the syringe, the needle cap, with my non-dominant hand, I'll place the ulnar side just below the injection site, using my thumb and forefinger to hold the skin taut, keeping this position until the medication is injected. With my dominant hand, I'll insert the needle at a 90-degree angle. I'll quickly insert it. After I've inserted it, still holding the skin taut with my non-dominant hand, I'll stabilize the syringe by gently grasping the lower syringe barrel. With my dominant hand, I'll move it to the top at the end of the plunger, making sure to avoid moving the syringe. Then I'll inject the medication slowly at a rate of 10 seconds. For the purpose of this video, I'm going to count fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After I've injected the medication, I'll wait 10 seconds. 10 seconds have passed. I'll smoothly remove the needle, release the skin, apply gentle pressure with a gauze pad. I will not massage the area. I will apply a bandage if needed. There is no bleeding, a bandage is not needed. Then I'll discard the needle and syringe in a sharps container. After I've done that, remove anything unnecessary, remove my gloves, perform hand hygiene, and document the procedure.